Hello, and welcome to today's ACEs Aware webinar, Regulating the Stress Response for Kids, Practical Tips for Primary Care Providers. This is the 7th educational webinar in a series that offers practical information on screening for adverse childhood experiences and providing trauma-informed care. My name is Sam Mills, and I'm with the Aurora Health Group, previously known as Harbridge Consulting, and it's our great privilege to be supporting the ACEs Aware initiative. I'll start today off with a few housekeeping items. If you run into any technical difficulties and get disconnected, please click on the join link you received earlier to return to the webinar, and we'll be with you as soon as we can. All webinar participants are muted, but you can submit questions at any point in time using the chat feature on the panel on the right-hand side. And lastly, thank you for the tremendous feedback you all have shared through our webinar evaluations. We've used that data to update our format for today to create more time for question and answer, more examples and tips providers can use directly in clinical practice, and hopefully less issues with technology. A recording, transcript, and slides will all be available at acesaware.org later this week. Now let's get started. The ACEs Aware mission is to change and save lives by helping providers understand the importance of screening for adverse childhood experiences and training providers to respond with evidence-based interventions and trauma-informed care to mitigate the health impacts of toxic stress. Today we'll hear from 3 healthcare providers joining us to discuss tips and strategies for helping kids manage stress. Dr. Dayna Long is an attending primary care physician and co-director with the Center for Child and Community Health at UCSF Benioff Children's Hospital, Oakland. Dr. Hilary Bowers is Director of Behavioral and Mental Health Services at Children's Primary Care Medical Group. And Dr. Pradeep Gidwani is the Medical Director for Healthy Development Services and First 5 First Steps Home Visiting Services with California, Chapter 3 of the American Academy of Pediatrics. On today's webinar, Dr. Long will kick us off with an overview of definitions, research, and resources on the clinical response to address toxic stress. She'll be followed by Dr. Bowers and Dr. Gidwani, who will share some tips and best practices for primary care providers to help pediatric patients and parents manage stress. Near the end, we'll also have all 3 presenters answer some audience questions. We received many questions in advance of today's webinar, and we invite all of you to submit additional questions via the chat function during today's webinar. We will try to get to as many questions as we can today, and we'll try to incorporate others into future activities. And finally, to wrap up the webinar, I'll share some resources and tools the ACEs Aware has developed or identified to support providers in responding to toxic stress for pediatric patients. With that said, I'm excited to introduce our first speaker, and we'll hand it over to Dr. Long to start us off.
Thank you, Sam. My name is Dayna Long, and today we're going to talk about the important topic of regulating the stress response in children. Definitions, research, and resources. The term adverse childhood experiences comes from the landmark study in 1998 that was conducted by the Center for Disease Control and Kaiser Permanente. The ACEs study described 10 categories of adversity within 3 different domains: abuse, neglect, and household challenges. Abuse is physical, emotional, or sexual abuse. Neglect is physical or emotional neglect, and household challenges are a broad category that incorporates growing up in a household where a relative's incarcerated, where there are mental health concerns, substance dependence, parental separation or divorce, or intimate partner violence. Data from the state of California shows that 60% of Californians have experienced at least one adversity, and 16% have experienced 4 or more ACEs. There are several decades of scientific research that have identified the biologic mechanisms by which early adversity leads to an increased risk for negative health and social outcomes across the lifespan. The ACEs Aware initiative is using the definition of toxic stress as being toxic stress is the repeated or prolonged activation of a child's stress response without the buffering protection of trusted, nurturing, safe caregivers and stable environments, leading to long-term changes in the structure and functioning of the developing brain, metabolic, immune, and neuroendocrine responses, and even the way in which DNA is read and transcribed. These biologic changes play an important role in the clinical progression from ACEs exposure to negative short and long-term health and social outcomes. In addition to ACEs, social determinants of health, such as poverty, discrimination, racism, housing insecurity, and food insecurity, are associated with health risks and may be risk factors for toxic stress. While we have validated odds ratios that are available for large population-based studies utilizing the 10 standardized ACEs criteria, the strength of association between social determinants of health and health outcomes has not yet been similarly standardized, but we're working on it. The definition of toxic stress that's being used by the ACEs Aware initiative is in the ACEs Aware Provider Toolkit, and it's adapted from the National Academy of Science, Engineering, and Medicine's 2019 report, Vibrant and Healthy Kids, Aligning Science, Practice, and Policy to Advance Health Equity. So what we have learned is that early life adversity, balanced by protective factors and predisposing vulnerabilities, lead to chronic dysregulation of the neuroendocrine immune system and can lead to clinical implications ranging from epigenetic changes to changes in our endocrine system, our neurologic systems, as well as our immune and cardiovascular system. So our stress response falls along a spectrum of 3 different types of stress responses. And it's important to recognize that with toxic stress, we are focusing on that end of the stress response spectrum. There's positive stress, and positive stress is the brief activation of a stress response, brief elevations in heart rate, blood pressure, and hormonal levels. And through the buffering effects of caring adults and other interventions, we can reach homeostasis once again. Tolerable stress is also short-term, but it is also somewhat more severe, but we have those buffering supportive relationships that allow us to regain homeostasis. Toxic stress is really the constant activation of a stress response in the absence of caring, stable, healthy, safe relationships, especially during sensitive periods of early development that can be toxic to brain architecture and other developing organs. Long-term changes in the brain and body are a result of this prolonged activation of this biologic stress response. There's a lack of the normal inhibition or the ability of the stress response to turn off normally, which leads to stress-related disease and potentially cognitive impairments. The clinical overview for how to identify toxic stress and ACEs includes 5 main steps. The first step is applying the principles of trauma-informed care. Next, the identification and treatment of ACE-associated health conditions such as asthma, eczema, allergies, anxiety, by supplementing usual care with patient education on toxic stress and strategies to regulate the stress response, including the 6 stress-busting strategies that we're going to talk about in a minute. Third is validation of existing strengths and protective factors to really focus on resiliency. The fourth is referral to needed patient resources or interventions. And some of these resources are educational materials. Others are really connecting with our partners, our social workers, our care coordinators, navigators, community health workers, as well as the 6 pillars that we're going to talk about next. The 5th really important element is follow-up. And we follow up as necessary using the ACEs presenting health condition as indicators of treatment progress. So now we're going to expand a little bit more on the identification and treatment of ACE-associated health conditions with a focus on the 6 stress-busting strategies. Those strategies include physical activity, quality sleep, balanced nutrition, supportive relationships, mindfulness, and mental health. So starting with exercise, this is exercising for 60 minutes a day, and it doesn't have to be all at once. And exercise might be turning up the music and dancing around with your kids, or going for a walk in your neighborhood, doing some jumping jacks or stretches. The next is healthy sleep and really encouraging good sleep hygiene, which includes having a routine. Balanced nutrition is also important. What we do know is that when our hormonal system, when the toxic stress physiology is being activated, we have higher levels of hormones such as cortisol that might predispose us to reach for higher fat or processed or higher sugar foods. And recognizing that that's probably not good for our health and really trying to focus on healthy nutrition. We want to be able to practice mindfulness, and whether this is prayer or meditation, making sure that we really can sort of strengthen the brain pathways that actively buffer the stress response is important. We want to be connected to our loved ones and our families and our communities during this really stressful time. And the last strategy is about our mental and behavioral health. And whether it's engaging with a mental health practitioner, with our primary care physician, with apps or videos that really help us to focus on our mental health, it's important that we take the time to take care of ourselves. I want to refer you to the ACEs Aware website. There are many resources on this website. If you look under Heal, under ACEs resources, what you'll see is that there are resources by type as well as by topic, and we encourage you to check out those resources. I also want to refer you to the self-care tool for pediatrics. And providers can use this self-care tool with their patients and their families to collaboratively plan and set goals for each of the 3 domains that we referred to, and they can follow up on this treatment plan as they go forward together.
Thank you, Dr. Long, for that great presentation. Next up, we'll go to Dr. Hilary Bowers and Dr. Pradeep Gidwani, who will present and share tips about some stress-busting strategies for pediatric patients. With that, I will kick it over to Dr. Hilary Bowers.
Hello, my name is Dr. Hilary Bowers. I am the Director of Behavioral and Mental Health Services with Children's Primary Care Medical Group, CPCMG. We serve children and adolescents across San Diego and Riverside counties. And it is my pleasure to be here to share some of the tips with you that I also share with my patients and families. So I know a lot of families are struggling right now with change. There have been a lot of changes. Kids are out of school, parents are out of work, people spending more time at home, which should be a great joy, but also is a big change. And learning how to deal with the stress of change is a challenge that I can talk about with my families. One thing I do talk about is you can only make about 1 to 2 changes a month and have them really stick. And you can pick a change that is easy to make, or you can pick a change that you think has the most impact. Often families like to start with the one that has the most impact because they want to just get moving and get going. I often recommend staying with what is the easiest change that you can make as a family? What's the easiest change that your child, when I'm talking to parents, that their child can make and really be successful? When you make a little change and a little change and a little change, next thing you know, when you're looking back, you've made a whole mountain of changes. If you do 1 healthy change a month, that equals 12 for the calendar year. And so 1 step at a time to really make that big mountain. A few things I like to talk about are what are things you can do anywhere, anytime, any place. I like to think that we all carry an imaginary toolbox with us, kind of strapped on. And when we're in a stressful moment, we can start pulling things out. And if somebody's only tool is to scream or yell or, punch a pillow, that isn't going to be as successful as if they have A to Z and have, 26 different items that they can pull out of their toolbox. So 3 things that I think about that you can do anywhere, anytime, any place are conscious breathing, color visualization, and painting your happy place. So conscious breathing is you breathe in through your nose, hold it, breathe out through your mouth. And so some people may think of this as box breathing. If you play a wind instrument, you want to breathe out longer than you breathe in. I've found that this is often a favorite item for stress reduction for parents, but for my patients, their children, sometimes they don't really like it. So even though we all as humans are breathing all the time and it's something we can carry with us, remember part of this is finding what works for you. What goes in your toolkit. So conscious breathing, color visualization, which is something I learned from one of my early mentors. And you imagine a circle, and I think you place a circle on your head, on your chest, on your belly. And what you start was with a red circle. So say I'm putting in my chest and imagine things that are red. So strawberries, red apples, fire engines, stop signs, roses, so things that are red. And red is often an angry color. It's very vibrant. It's very, and as you're breathing in through your nose, out through your mouth, so you can pair it with the conscious breathing, then you have concentric circles that are a little bit bigger. So now I have an orange circle. The orange circle could be filled with California poppies and oranges. And then a next circle is yellow. And usually at this point, when I'm teaching my patients, whether they be in person or via telehealth, I ask the patient to give me something that's yellow. And because that way you make sure that they're engaged and that they're really listening and learning the skill that you're trying to teach them. So things that are yellow, bananas, lemons, sunflowers, sunshine, minions, that one usually gets a laugh. And then green, so the next big circle is green, like grass and clover and pine trees. Blue, like the ocean and blue jeans. And then you have purple, like eggplant, violets, sunsets. So by the time you get to purple, you have this big purple circle that's covering you, and purple is a much calmer color than red. And then you can kind of breathe out whatever that stress is that had been building up. And again, you can do it in the middle of math class. You can do it lying down on your bed. You can do it while you're taking a walk with a friend, because people don't know it's sort of what's going on in your head. So the third item is painting your happy place. What does it look like, smell like, feel like, taste like, sound like? Where would you rather be? And you can do this out loud. You can do it on a piece of paper. You can even just do it in your head. And you want to be so descriptive with it that you actually are transported to that location. Because when we're thinking of a place that makes us calm, we're thinking of a place we'd rather be, decreases our heart rate, decreases our respiration rate, makes us be more in the moment. So again, we can then step forward and address any stressors that we have. So there's three things: are conscious breathing, painting your happy place, and color visualization. Another item, especially with the younger kids, is I'll talk about the cool down corner. So often parents are pretty familiar with timeouts, and I like to really differentiate that timeouts are discipline worthy. So your kid ran out in the middle of the street, they were playing with the heirloom, they broke it. There's something that was safety or infection control, and they violated the house rule in that way. And so that is a timeout. A timeout is something that is parent controlled and parent directed. So the child is removed. For example, say you hit your sister, no hitting, hitting hurts, you're in timeout. So very short, 6 words, you're done, you're gone, and you go to the timeout zone. And then how long the timeout is based on the kid's age. Usually say about 1 minute per age. But again, that is parent directed. Cool down time is what we do before timeout time. So this is, you're seeing your kids are starting to get a little amped up. Maybe dinner's taking a little longer than you wish it would. Everybody's hungry, starting to get a little fussy. Nothing's happened yet, but this requires you as a caregiver to make sure that you are really in tune with your children. And when it's cool down time, you say, hey, it's cool down time. And cool down time is where the child is directing it. So that means they go to the pre-designated cool down corner. And maybe there's a box or some container which has things that they can then utilize during cool down time. So it may be a pillow that they can punch. It could be some slime or silly putty. It could be a fidget, paper and crayons. If the kids are trustworthy in that age, you could have scissors, or otherwise just paper and rip it up into tiny pieces. An old magazine can be useful. So maybe a fan, a pinwheel. I actually like to use pinwheels quite a bit because by making a pinwheel blow, you are forcing the person to take a big breath in and a long, slow breath out. So you're actually teaching them how to do conscious breathing without saying breathe. You're just having them use the pinwheel. So having all those things in a cool down corner, and then how long does a child stay in cool down? That's up to them. Cool down corner is all about social emotional self-regulation. And when they feel they can come out and then interact in a way that's healthy, they're allowed to come out. So if it's 5 seconds, 5 minutes, 3 hours, it's really up to them and the family. As a provider, you can educate your parents to model the behavior they want their children to do. So give an example of, say you're making dinner, the kids are starting to get a little squirrely. You can turn and say, wow, I am feeling frustrated, right? You always want to name your emotions. You can name it to tame it. If you say what you're feeling, then kids can help understand what they're feeling. So you can say, wow, I'm really frustrated. I've asked people 3 times to help set the table. Nobody started. I spent a lot of time today looking up a new recipe to make for my family. I took a lot of pride and joy in that, and I don't feel appreciated as a parent right now. I'm really frustrated. I'm going to go to cool down time. And, make sure the kitchen's safe. You've turned off the stove and oven. Nobody can get hurt. And then you make a big deal of it. You march right over to cool down time. You sit down in a chair, pick up the magazine, punch the pillow, whatever it is that's in your cool down corner, and that helps you. And you can breathe and you can huff and you can puff. And I always tell my parents, use my name, say, oh, Dr. Bowers said cool down corner is going to be really helpful. I don't know, but I'm going to try it. And so you go out and you do it. And over time, as a parent, as a caregiver, then you start slowly coming back down and you're cooling down, and maybe you're just flipping pages angrily, but over time you're like, oh my gosh, that's so funny. And you're like, hee, I really want to tell someone about what I just read. And then when you're done, you're like, wow, I feel so much better. I'm so glad that I took the time for myself. And then you can go out like, wow, I really feel like I want to give somebody a hug because I feel so good. Does anybody like a hug? You always want to ask permission before getting in someone else's personal bubble. You don't want to force children to hug or have physical contact if they're not open to it. So if they are, you're like, great, thank you. That hug felt so good. And if they don't want to hug, you say, that's okay. I'm going to hug myself. I'm going to give myself a high five and say, way to go, mommy. Way to go, daddy. Way to go, grandma or grandpa or auntie or uncle or whoever modeled that behavior. Thank you so much for taking the time for myself. And then you go back and you do the other activities. Often the first few times that a caregiver models this behavior, especially if it's really different, children will watch you with very big eyes. And they're like, oh my gosh, what's happening? And maybe they'll even approach you because children are very empathetic. They'll come over. They may pet you, they may try to give you a hug or sit close and get quiet, and they'll watch you because they're always watching you. So if you are modeling the behavior that you want them to be doing, they will be much more successful in learning those behaviors. Research in ACEs with children shows that having even one supportive adult gives them more resilience to get through whatever stressors they're living in with their life. So then I talk with my families. How can you help foster those relationships? One of the most important things for parents to think of is just listen. Just being there, just being present. Your child will come to you usually at the time that you're stressed, that you're busy, that you wish you could be going to bed, but that's the time that they really need to talk. And what they don't want, usually, especially teenagers, they don't necessarily want a quick fix. What they want is a listening ear. They want to know that they are heard, that you care about them, that you love them, and that you'll be willing to listen again in the future. So I tell my families, just listen and hear. Often by asking reflective questions, the child will come up with their own solution to their challenge. In addition, thinking about how can we connect with people outside of our household. So are we having Zoom meetings? I know in our family, we've connected with grandparents via Zoom. We actually set up with my grandfather at his retirement facility a piano concert. So my children played piano on the iPad. They had one set up on their side, and he was able to participate. He could hear their music, he could see their faces. They got to feel the joy of sharing their gift with somebody else. And so things like that, maybe connecting with the senior center in your community would be something if you don't have extended family nearby. Thinking about how we can take walks, maybe a play date on the driveway, something where, again, you can see another person, you can connect with these people. One thing we've been doing as well is baking for others. If this is something people will accept as a baked good from somebody else's home, is to do that. And then we call it sprinkling. We leave a little note and a little something, and it doesn't have to be much, but again, the children finding some way of sharing themselves and getting outside of their own head, finding purpose to their day is very important. One of the things I'd really like to convey is that the words behavioral and mental health can sound very scary and daunting. And how can I, as a general pediatrician in a busy practice, nurse practitioner, PA, social worker, teacher, who am I who's taking care of kids and adolescents across the spectrum? How can I bring something to the table as their caregiver to help them and their families cope with stress, anxiety, worry? In addition to making connections with other humans, it's also important to make a connection with yourself. And often this can be thought of under the umbrella of mindfulness. And how do we become attuned to our own emotions and learn a little more social, emotional self-regulation? One of the tools I often recommend to families is journaling. But journaling can come in a lot of different formats. There's the traditional journal, where it's what I think of as a closed journal, where you are writing your own feelings and thoughts and pictures, but then it's closed and it's kept for yourself. So it's really for your own self-reflection. I also really like recommending what I call an open journal. And this would be where the child or the parent or caregiver, one of them writes something down, because we all know our best ideas come late at night or when we're having quiet time. And we write down something or we draw a picture, and then we shut it. And you can have, some families have done a mailbox, so they get to decorate that. So that's a fun arts and crafts activity to make a mailbox by your bed. And then you can write a letter to your parent or caregiver when the mood strikes you, and you put it in their mailbox. And then the parent reads it, or whether it's the mail or whether it's a spiral bound notebook, then they read it on their own time. And then they write a response, and then they give it back to the child, and the child can read it on their own time. And so this is really a wonderful thing that works across ages, because often it's very hard to say something that's very important to us, that's really deep in our sticky bits. It's hard to say it eyeball to eyeball. And so when we're able to share that with a piece of paper and then give it to our caregiver, and then the caregiver can give it back to the child or adolescent, it is something that really helps keep the conversation moving. The third way of journaling, I actually learned from one of my own patients who shared it with me. And this is what we're calling a color journal. So instead of words, we use colors. So across the top of the page or across at the front of the journal, you would do a rainbow of colors, whatever colors you want, and you assign each color a mood: happy, sad, contemplative, whatever thoughts. And then every day, and then you draw a calendar. And so every day you assign one or two colors to that day. And then at the end of the week, at the end of the month, you have a very good visual of what things were like over that past week, 2 weeks, month. And for some families, this is actually the breakthrough moment where they understand how much their child has been struggling. Because often the words maybe don't convey. We all know, especially adolescents, they want to put on a brave face. They don't want anyone to feel like anything's wrong. And they may not fully express how much they're struggling. But the color, there's no word. And it's hard to deny if blue is sad, to see a whole month of blue. And then that can then really open some doors. Then you, as their pediatrician, or other doctor be able to then help facilitate that conversation. Another thing I like to think about is language and how much language really matters. Often families will come in and again, sort of more the traditional Western medicine model where something's broken and then it needs to be fixed. So parents will talk about their children's behavior as in, I need to fix this, which implies that their kid's broken. And I sort of reframe that and say, well, your child's not a car, it's not a bike, your child's a human. And what we have is we have a challenging behavior, and your child doesn't have the tools to really express themselves in a way that we say is healthy. So what are they doing? They may be kicking and biting other kids at school, they may be breaking toys, and the parents want to, quote, fix that negative, destructive behavior. And I like to think a little deeper. So why is the child acting this way? What can we do to give the child the tools to express themselves in a way where they can be heard and they can have their needs met? I often use sports analogies and so say, we have a bench of people around us that support us. So there's the child in the middle, and they have parents and caregivers and grandparents and extended family and teachers. And also with that, we may have the orthopedist who lives on the bench. So when we have a broken bone, we can go to them and we can get a cast. We may have a counselor that's on the bench. So when we're struggling a little bit more with our emotions, we can go to them and learn our skills of how do we express ourselves in a healthier way. And so thinking about it more as a coach and more as this is a bench, and these are lots of different people, and often our parents are our first people that we go to for help. But sometimes parents don't have all the answers. So that's why they come to their pediatrician. That's why, we go to the specialty care. And so thinking of it in that way, that we're getting coaches to learn the skills we don't have, and that we have challenges in life. And what we're looking for is ways to express ourselves in healthy, productive ways so that everyone can get what they need and be able to feel heard. So we've talked about some things such as journaling, mindfulness, being aware. So things you can do as their caregiver, and things you can teach their caregiver to help them, things you can teach your patients are the following. You can teach them to keep a journal. So be that the open or closed or the color journal that we talked about earlier would be very helpful. And again, that's a concrete, actionable item that they can have and then they can take with them. Just the act of writing down the food or keeping track of your intestinal habits can really make something that seems, I don't know when it happens and it seems so scary and daunting. Now there's a pattern to it. I can understand that. And often I'll tell my families, keep the journal for 2 weeks, 4 weeks, and then make an appointment when you leave here today to come back and see me and bring the journal with you. And I tell them, often you're going to look at the journal, you're going to figure out the pattern yourself, you're going to be able to make the healthy changes on your own. But it's okay if you don't, because I am here as part of your journey, and I'm here and I will be here to listen.
Thank you, Dr. Bowers, for those great tips and stress mitigation strategies. Next up, we'll hear from Dr. Pradeep Gidwani on some other stress-busting strategies related to mindfulness and supportive relationships.
Hello, I'm Pradeep Gidwani. I'm a pediatrician in San Diego. I work for the American Academy of Pediatrics, the San Diego Imperial County chapter, and I'm the medical director for one of our projects, Healthy Development Services, as well as a home visiting program called First 5 First Steps. So today I'm going to talk about some tips about how we can reduce stress in our pediatric patients. And of course, when we think about stress for our pediatric patients, we have to think about how we can help their parents. Both the parent and the child need to have the opportunity to regulate their stress. So one of the things that works really great for stress is breath work. And when you think about breathing, it's a way that helps us connect our emotions and our mind. And it helps us calm down and slow down. So depending on the child, you can do a variety of activities that I like to teach parents. One of my favorites is one where you actually draw on one side of a paper, you draw a candle, and on the other side, you draw a flower. You have the child smell the flower, then you turn the paper over and you have them blow out the candle. It's a really fun way for the parent and the child to interact. And of course, it also works for parents as well. So teaching parents how to breathe, just to breathe in through their noses and slowly out through their mouth, and watch them actually feel different as they're doing that. What's really interesting about that is it takes a really short period of time to do it. With parents, you don't need the visual as much as you do with children, but with kids, the visual always works beautifully. One of the things we have all the time handy is bubbles. Blowing bubbles is a great way to do the same piece. And again, what you're trying to do is help them slow their minds down and to be more present in their bodies. So actually, that's another piece that we do. Whenever we're talking about these pieces, we ask kids and parents to feel themselves in their bodies. And there's so many different ways that you can help kids and families get into their bodies. Particularly as kids get older, you can do things like push against a wall, touch furniture. Simple things where you can really teach ways for people to regulate. Another great one, particularly in this day and age, is going for a walk together. There's two things that happen when you walk together. One is you get into that rhythm of walking, and in that walking, it really helps us calm down, and it helps us really truly become grounded. So this whole piece about learning how to regulate our emotions and understand our emotions and how they work with our thoughts is so important for all of us. And again, kids can start learning these skills very, very early. So one of the things we like to do with kids as they get older is to use their imagination and to create a special place. So when a child is upset and they need a little time to collect themselves and get their emotions more clear, we talk about creating a special place. And that can be fun, and it really depends on the child. So if a child really likes animals, then they could go to a zoo, or they could go to the forest, and they could talk with animals. They can use their imagination. They can just have a lot of fun with this. Some kids like castles, and you can have this whole thing about going to a castle and who you meet there, and again, have them really think about things to really get their mind active so that they're really allowing their emotions to calm. One of the things we know when we have really strong emotions is it takes time to recover and it takes time for that to calm. Another trick that we use, particularly with younger kids, is the idea of a balloon breath. And so the idea around a balloon breath is you have them take their hands and put their hands on their belly, and you have them blow up their belly when they breathe through their nose, and then breathe out their mouth, and they let the balloon out. And so that idea is, again, very helpful, because what you do with that is the mind calms as we take longer breaths. Particularly breathing in the nose and out of the mouth really helps calm kids down. So that whole idea of having them think of their belly as a balloon, and they blow into the balloon, and then they blow the air out, and at the same time they have their hands on their belly and the belly goes down. So they get that really cute idea of really feeling how it works to do what's known as belly breaths. Another thing that's really helpful is to ask kids to check in with their bodies. And so what you can actually do is ask them to check into different parts of their body. You can ask them to listen to your heart, feel your belly. These are really simple things that are super helpful for kids. Another set of strategies that are particularly useful for adults, because again, adults don't always understand that kids can't always regulate their emotions by themselves, but they need help to be co-regulated. So the idea of telling a parent, of walking through a situation with a parent when their child really got upset, and helping them understand that their child may not be able to reason when they're very upset, and that you have to let them calm down, and that if a parent stays calm, that helps the child calm down, is a really important concept. So this idea of co-regulation, sometimes when I explain it to parents, it's like a light bulb. They think, oh, I thought if my child's upset and I get upset, they'll understand. No, they actually just get scared. If your child is upset and you stay calm and you can hold that space, that gives room and space for the child's emotion to run its course. Then when the child's emotion has run its course, you have the chance to reconnect with the child and actually help the child reason and figure out what happens. Sometimes when we're trying to help children calm down and we use words, they sometimes get more frustrated. So a trick that I love to teach kids is their own ability to use their sense of touch and their sense of imagination. So you can ask a child just to rub their hands together and then put their hands to where they want to put the energy. And you can actually have them put it where it hurts, but sometimes it's really easy just to have them rub their hands and then just put them on their heart, or rub their hands and give themselves a hug. It's a really interesting thing that when words don't work, sometimes we actually have to use the physical body to calm down. And again, that rubbing your hands together and putting your hands on your heart, it's one of those pieces that is so simple, but it's a trick that once you teach a child, it's always amazing when they actually get comfortable with that and see that it works, that they'll do it themselves. You know, another strategy that's really, really helpful for parents at this time, and this is really that important part of relationships can be very helpful in strengthening us. One strategy I use with parents that really helps comes from narrative medicine. And when I have a moment with a family, I'll ask them what or who is helping them the most right now. As a family starts talking about that, they really start feeling that support that individuals give them. So questions like, what or who supports you, or what is giving you strength right now, is really helpful. We really want to meet families where their strengths are. You can also ask them about, in the past, who or what has helped you in the past get through tough times. And another piece, just to take it a little further, is as you ask those questions, you can ask the parent to think about how does it feel in their body. So remember, as much as it's important to build skills in kids, we want to build skills in parents as well. With the parents, if we can really help them think about who's there, who helps them, that's a really important piece. Okay. So another really important stress-busting technique is exercise. And it's really interesting. Again, each individual has what works for them. I found a lot of our patients really, really resonate with exercise. And it doesn't have to be anything as big as running a marathon. Actually, just taking a 15 to 20 minute walk can go a long way. I really do recommend walking. It's very easy. It has less injuries. The other part, you can do it with somebody. So there is that other piece of regulating relationships where you have a relationship that helps you. So you get two things. You get the walking and you get the relationship. Trying to help families get to mental health services can be a really touchy subject. Families can become very resistant. One of the things that we've done that really helps with families is helping them realize that we all need someone to talk to. And sometimes it's good to talk to somebody who is a professional who doesn't have any relationship with you, but can really offer you a place where it's safe, and what they say, what you say, will stay with them. So often we kind of help families understand what it looks like and why it would be helpful for them to get mental health services. And again, it's really about that piece of helping them understand taking care of themselves helps them better take care of their kids. So today we've given you so many different tools and techniques. It's really important to find the ones that are easier for you and what work for you. Most importantly, have the ones that are your go-to, and also have enough, because really the goal here is what works for families. You don't have to try all of these, and you don't have to do all of these. Find the ones that work for you and work for your families. One of the important pieces is many of these tips can be done in this environment where we're seeing patients in a virtual way. I always like the ones that are easy to describe or easy to show on the video screen. The other part is have fun with these, because it really is a great way to connect with your families in a way that they know that you care about them as a person. And I just find that these actually help build that relationship that we always want for our families, and they really do feel supported.
Thank you, Dr. Gidwani, and thank you to Dr. Bowers for those great tips and strategies. Now we're going to go to some questions from our audience members. Our first question comes from Marjorie, and Marjorie wants to know, what can we do on a daily basis to help build childhood resiliency for patients? Dr. Bowers, I'll have you start.
Thank you so much. That is an excellent question, Marjorie. It's all about what can you as a caregiver help for your child. So things I like to think about are having children being seen and being heard. So just even being present. I think often as parents, we try to feel like we have to come in with a solution for our child. Every challenge, every problem must have a solution. But with the resiliency, what we're trying to cultivate is to have their own problem-solving, challenge-solving skills. And so just having them being seen, being heard, being present for them, and having a good listening ear, helps build resiliency, because then they know the next time they have a challenge, they have a trusted adult they can come to. Soothing is also important. So always asking permission, but giving touch. So letting a child just sit in your lap, giving that hug, holding their hand, stroking their shoulder, whatever's an appropriate one for them. That soothing is, again, calming and breathing. So a couple things that you can implement now to help your child.
Dr. Long, how would you follow up to Marjorie's question on building resiliency for patients?
So I agree with everything Dr. Bowers just said. And I think that skill building is really important for resiliency. And so when we think about breathing, there actually is a technique that I teach to my patients, and that technique is called 415 breathing. And it's actually a way to ground yourself. And on a biologic level, it helps us to flip between our sympathetic to our parasympathetic nervous system, which helps to regulate the toxic stress response. And so 415 breathing is really about sitting with your feet grounded on the floor, sitting up straight, taking a moment to close your eyes, and then you breathe in to the count of 4, you hold it, and you breathe out to the count of 5. And it actually helps to do this technique throughout the day. It helps us to stay focused. The other part of building resiliency is knowing when we are dysregulated, that there are these 3 principles about centering, collaborating, and connecting, and that in order to move through our day, we as adults have to center ourselves and to recognize when we're not centered, to take the time to really be mindful of that, about making sure that we are connecting to our children and our loved ones. And then lastly, that we are collaborating with our coworkers and our community so that we can get through this together.
Thanks, Dr. Long. Dr. Gidwani, follow up for you. What are things you think we can do on a daily basis to build resiliency in patients?
Well, I think the most important thing when we're thinking about resiliency is to understand that resiliency is built in the context of relationships. So it really is your relationship with your child. And what really helps is the regulation and co-regulation. When babies are little, they need external co-regulation. As kids get older, they still need that regulation. I often think with teenagers, that's another period of time when there's so much growth and change happening in the body, and we forget they need some help regulating themselves. So some of the techniques you've heard about breathing and some of the other pieces are there. But the real important part for parents is to connect with your child, allow their regulation to calm. You can't really reason with them when they're feeling really upset. So let them regulate, whether it's through touch, whether it's through talk, but let their level of emotion come down. And when that comes down, you connect with them, and then you can reason with them. So it's a real process around regulate, relate, and reason. And it's just a nice, simple way to remember that this is a skill that's built over time. And it happens in the context of relationships. And as an adult, as Dr. Long said, you need to be able to center yourself. So make sure you always check in and calm yourself and work with your own emotions as an adult, and connect with your children and help them build that skill of understanding their emotions and understanding how they can calm themselves and how you're there for them. And I think that piece that both Dr. Bowers and Dr. Long talked about is being there. That's the important part. That regular routine, person being there, is such an important key to resiliency, and it happens over time.
Thank you all for those great responses. Our next question comes from Norma, who's a healthcare provider. And Norma wants to know, what type of follow-up care can we do, whether face-to-face or via telemedicine, to follow up on stress regulation strategies for patients? Dr. Bowers, I know that you talked about telemedicine visits earlier in your presentation. I'll have you go first.
So I definitely have a combination of face-to-face and telemedicine, although I feel like at this point it's about 70% is telemedicine. The families love it because at first you think, oh, are they going to connect through telemedicine? Is it going to feel like an awkward thing? But as was said earlier, they're at their own home. I found patients to be far more relaxed. They haven't been in my office waiting if I'm running late. They can go and play a game. They can be writing outside. Often I get to meet all the family pets. And so things that you won't see normally in an office setting, which sometimes can feel artificial, even if we have all of our tools there, we can feel much more intimate and connected with our families via telemedicine, because you're coming to their living room, their bedroom, their car, the garage. I've been to Costco, several other places on telehealth visits. So it's a really excellent way. Another thing I'd like to bring up is sometimes families are on vacation and normally they would cancel the appointment because they're not going to drive back 2 hours to keep it. So this way you can stay on track with your follow-up. Even if they're on vacation, they can dial in, have that connection, have that follow-up appointment, and you know the care is still being delivered.
Thank you, Dr. Bowers. That's a great segue to our next question that comes in from Katrina. Katrina is asking, how do we address toxic stress during this time of COVID-19 with our patients and our families? Dr. Gadwani, let's start with you.
Well, that actually really builds on the whole opportunity of connecting through telemedicine and telehealth. We've really found that you can really provide a lot of support, even in short blocks of time. It's also important when you're working in telemedicine to work with the family to see where they're comfortable. Sometimes because there's a lot of people around and it can be a sensitive topic, sometimes it is actually worthwhile doing it on the phone so that they can have that privacy. So it's really always finding what's comfortable for your patients. And the important part is to always remember to think about safety. It's something that we think about, but when they're coming into our office, we know we can provide a safe environment. We want to make sure that that telemedicine or the medicine by phone really, without the video, is really something that feels safe for our clients. And our patients, when they feel safe, they build that trust. And it really has been surprising how well families have been doing with video and with phone calls. But it really becomes important to have touch points, have multiple touch points, and also make sure that you're helping them with routines and what they can do on a day-to-day basis to help ground themselves and to help themselves feel safe and have the resources that they need. Another technique that I really like is just asking them who is helping you or what helps you in this time, whether it's church, whether it's friends. Many of our families really do have resources, and we want to remind them this is the time you need to reach out to those resources and not think you're going to be a burden on others. It's actually really a good feeling when someone calls you and needs your help. So to help them remember, it's giving the help, but it's also receiving the help.
Thank you, Dr. Gadwani. We have another question from Grace. This question will be for Dr. Bowers, who's a provider in mental health. Grace wants to know, what can we do as a provider when we have limited resources in our community around mental health?
So one thing you can do is talk to your coworkers. So this is a question from providers about providers. Talk to your coworkers. You'd be surprised what people know, either through professional or personal experience. And even among providers, behavioral mental health can still be a stigmatized topic, and people may not be as forthcoming in sharing what they know as if they were with the latest otitis media guidelines or pneumonia guidelines. So having that conversation, making it be a weekly or twice a month conversation with all the providers in your office to say, what have you learned? What have you talked about? The American Academy of Pediatrics has a nice podcast about the Behavioral Mental Health Minute, which is great. In Southern California, in the San Diego County, Riverside County area, we have Smart Care, which is an excellent resource to help connect you with services for your patients, as well as giving information from a provider to provider level to help keep patients in the home. Talking to your local preschools, talking to your local schools and seeing who they are connected with. Often we really operate in a silo, and taking you as the provider who's interested in this, saying, I'm going to take responsibility for breaking down these barriers and making better connections. And not the last item, but one more item is I actually get a lot of information from families that someone they've connected with. It was mentioned earlier, religious groups have many services, other community groups that are out there. So finding this, I think, really tells your patients that this is a two-way relationship, that you are there for them and they're there for you. And as was mentioned earlier, it is a wonderful feeling to help and to give and to share your knowledge. And hearing that from a patient, letting a parent give you information, and then you saying, wow, that's great, I'm totally going to share that with my next patient, could be the lift that they need in the day, especially now when things are quite a bit more stressful for many families.
Our next question will be for Dr. Long. This person is asking, how can we promote resilience in the time of the pandemic when many of the ones who need it most aren't connecting with us?
Oh, thank you for this question, because I do agree that a lot of our families have benefited from telehealth and are either coming in person or were able to connect over the internet. And there is a subset of our families who we haven't yet been able to reach out to, and this is where the proactivity comes in. And so if as a clinic and as a provider, you recognize that there are patients that you haven't reached out to, it's definitely the time for either you to call as a provider and say, hey, I just want to check in, or to have the office team call the family and see if you can schedule a visit. It's really important that we figure out the best way. And it might be that some families actually don't feel comfortable having conversations via Zoom and would come in and get your vaccines or your developmental assessment, or just to say, hello, we have a concern. And so being able to reach out to diverse populations is important, as well as messaging from our clinics that we are here for you. We are open, that we care, and please come see us, and that we are providing safe spaces.
Thank you, Dr. Long. Dr. Gidwani, is there anything else that you would like to add?
I think the important thing is there's always going to be a shortage of mental health services. And I think what's really important is for all of us to understand that you don't have to be a therapist to be therapeutic. Our relationships, which really support our families, and particularly because we have relationships with them, can really be such a big uplift. And so again, I think it's so important to convey to them that they're safe, they can speak with you, and it's important to hear their stories. And if you can hear their stories, often that makes such a big difference. People are holding so much in their mind right now. There's so much depression, there's so much anxiety. And if we can encourage our families to talk with us, you can actually see their shoulders drop. You can see a visible change in their faces. And again, we have to also be aware of what we can do, not always aware of what we can't do and what's not there. That becomes really draining for us when we are focused on how much more we want for our patients. If we really could, we would provide so much more in the way of mental health, child development, all of the stuff we'd love to provide. But in the meantime, what you do makes a big difference. Listening to, being supportive is such a powerful, powerful tool. You as a person make such a big difference to your family's lives.
And now for our last question. This one will be for Dr. Long. How do you start anticipatory guidance following a Pearls scream?
Thank you so much for the question, Sam. We have spent a long time doing years of research around the Pearls tool as we were developing it and piloting it with our families. In the process of piloting it, we interviewed providers within our clinic and collated using thematic analysis all of their responses. And we were able to create a very simple acronym for providers to use when they're giving anticipatory guidance for Pearls. That acronym is NOTE. As doctors, we write a lot of notes. And so the N stands for noticing the relationship between the caregiver and the child. Notice it and comment on it. You can say, every time you look at Sally, she smiles back at you. You are a hero in her life. Or, I love the fact that Johnny wants to give you a hug. The O is for offering the science. And I always say the same thing, that what we know is that stress can affect the hearts, the minds, and the bodies of children. The T is for tools. that in this clinic, we have tools and resources to share with you so that we can get through this together. And the E is that you are a good parent. You're doing a good job. Every single day is a day to start over. You are a hero in the life of your child, and you got this. And I am here with you in this every single day. So the NOTE acronym is really helpful as we start to talk to families about what the Pearl Screen means and what our response is.
Thank you to our great speakers and for their thoughtful responses. And many thanks to all of our attendees who submitted questions in advance and during today's presentation. Now I'd like to highlight some key resources and tools that have been developed by ACEs Aware and other organizations to support providers as they screen and respond to ACEs and toxic stress. ACEs Aware has developed a free, comprehensive training for providers that offers continuing medical education and maintenance of certification credits. It covers the science of ACEs and toxic stress, how to screen for ACEs, and how to implement trauma-informed care. Once you take the training and self-attest, Medi-Cal providers are eligible for a $29 payment for conducting ACEs screenings for pediatric and adult patients covered by Medi-Cal. More information is available at our training site, including the self-attestation form at acesaware.org. As Dr. Long pointed out earlier, we have many resources available on our website that we'd encourage you to check out. One of those resources is the ACEs Aware Provider Toolkit, which has comprehensive information about the initiative, including all the topics you can see highlighted here on the screen. We will also continue to hold webinars on a wide range of topics that are responsible to your feedback shared through our webinar evaluations. Please stay tuned for more information on our upcoming September webinar. In wrapping up today's webinar, I want to thank all of our wonderful speakers for sharing their expertise, time, and experience, and to thank all of you for attending and participating by submitting questions in advance or via the chat. Later today, we will be emailing you a webinar evaluation. Please be sure to submit your feedback as it helps us to plan for future webinars and materials. Finally, a recording of this webinar will be emailed to all attendees and posted on the ACEs Aware website later this week. So please be sure to share with your colleagues and others that might be interested. Thank you again, and take good care.